presentation? We are loading. And yes, yes, we can see your screen.
Okay.
From KwaZulu-Natal University.
Yes. My name is Blose. I'm a physiotherapist by profession. I am currently employed as a lecturer at the University of KwaZulu-Natal, and I will be presenting to you a proposal for my PhD study that is titled Translating Theory into Practice, a framework for implementing community-based rehabilitation in KwaZulu-Natal. And I think coming from the previous presentation, for me, it makes more sense and justifies the purpose of the study that I'm currently have embarked on. Because Manguzi, it's part of KZN, and what they're doing there, it's wonderful, but we don't see it translating throughout the province. That's just a by the way. But for me to get straight into my presentation, I think we know that globally, there's over 1 billion people with disabilities, and 80% of those are from low and middle income countries. And we know that people with disabilities still are found to be amongst the poorest and the least empowered people globally. They experience limited access to basic services, especially in the low and middle income countries. There's also a high level of infringement of their human rights, despite the availability of policies and documents that have been developed to redress the gap that still exists. In the early 1980s, following the Alma Ata Declaration, CBR was then developed. And when it was established at that time, it focused more on health and rehabilitation to be made accessible to communities where it was lacking and was not available. And following that, there was a United Nations Convention on the Rights of Persons with Disabilities that then assisted in developing a CBR matrix from what it was focusing on just health and rehabilitation, but broadened it into a matrix that also included in it education, livelihood, social and empowerment of people with disabilities. And the whole aim of that was to address poverty so that poverty is alleviated. They look at social inclusion and equalization of opportunities. And now globally, CBR has been implemented. And we know that the low and middle income countries are also signatories to the United Nations Convention on the Rights of Persons with Disabilities. South Africa is amongst the countries that are also implementing CBR. However, the extent and the nature of implementation is not known. More particular, KwaZulu-Natal has been one of the provinces that is implementing CBR, mainly through various non-governmental organizations. But to date, there is no set framework or guide that guides implementation of CBR across the province. And this has resulted in the duplication and uncoordinated CBR services as services are being implemented across the province. Therefore, my aim for my study is to then determine the current trends of CBR practices in the province of KwaZulu-Natal, and then develop a tool for integrated implementation of CBR across the province in KwaZulu-Natal, also in public sector. The study has adopted a pragmatic approach with mixed methods. In this, we look at the social model of disability that would then form a guide for this explorative study. And we are using an advocacy and or participatory philosophy worldview. Unlike the post-positivist view that imposes structural laws and theories, the participatory advocacy view takes into consideration the marginalized individuals in society. Social justice issues fit this approach to qualitative research, as it also acknowledges and takes into account people's lived experiences. An interpretative phenomenon will be used for data collection through focus groups and interviews with identified participants. For discussion, the information that would then be obtained from the participants of the study will be discussed in relation to the research question, using a narrative to identify and explore emergent themes. The review will provide a baseline of evidence on the implementation of CBR in KwaZulu-Natal and will highlight gaps regarding the implementation of CBR in the context of the province. At the end, a Delphi study will be undertaken to develop a framework for implementation of CBR in KwaZulu-Natal. All this will be done with the hope that once a framework is then developed, it would be able to be implemented across the province to standardize the implementation of CBR across the public sector in the province of KwaZulu-Natal. Thank you.
Thank you very much for the presentation. We are happy you made it well in time and presented an interesting topic, which is close to heart for all of us working in rural rehab. I want to invite comments and questions to this presentation, to the presenter. Yes, Mareike?
Hi, Mr. Blose. How are you? It's Marika.
Hi.
Long time we missed you in the province, eh?
Hopefully I'll come back, hopefully.
Yeah, damn straight. I think my concern is really that, like, yeah, CBR and rehab, it in the words of our parent facilitator, it's like the body and the soul, you know? One needs the other. And that, yeah, how will we use CBR as an augmentation tool instead of having two silo programs?
Okay. Can I respond?
Yes.
Okay. All right. Currently, if you look at how things are done in province, the left does not know what the right is doing.
Yeah.
And so I'm hoping that at the end of the study, once we have a framework, it would then be able to match the two. Because one of the things that we are also picking up, it's what I would refer to as a conundrum to CBR definition, because what I've picked up is that people understand CBR differently, and therefore, when it comes to implementing of it, especially amongst the healthcare professionals, there's a miss that's there. So once a framework is available and we have partners, part of it will then be looking at how we match rehab and CBR. And also how we then, as you said, it's a soul and a body, how we bring the two together so that we work harmoniously together towards a specific set goals that we then set for ourselves. So it's still a lot of work that needs to be done. It's still a lot of convincing and getting people to buy into CBR itself, and see how it then fits in itself into rehab and the program, rehab program in the province, and the priorities and the goal of disability and rehabilitation in the province. In that way, I think we'll then be able to not be side by side, but be able to then work together as a team for a common goal.
Thanks.
Thank you very much. Is there any question from the online visitors? It seems not so. Then we would proceed to the next presentation. Oh. Hmm? Okay, Sitembiso. Hello?
Yes, I'm still here.
Is there anything you would like us as a on-site group to contribute, or are you happy with the question you got for food for thought?
I'm happy with the question, but if there are more, because one of the things that I'm looking at is to see how others would look at the study and how they would contribute so that for me, the end goal is not just KZN, it's the whole country and implementing CBR in a similar way. But I had to start somewhere and KZN was then closer. So if there are any other ideas that would come from the floor, anybody, they are welcome to be brought forward. And it will only make the study stronger going forward.
Okay, one question is here, is the last one from Kate, ne?
Hi, Timbiso. This is Kate Sherry speaking. I'm an occupational therapist. Thank you for your presentation. I'm really glad that you are doing your PhD. I feel like I've seen quite a lot of PhD proposals the last few years that want to develop a model for rehab provision, for CBR, for whatever. And the problem that I always have is methodologically, how do you turn research into a workable model? I usually find, like most of the proposals that I've read that look at building a model, sometimes often the student has a particular ideas in mind already, but I can't get the theoretical link from gathering information to jump into something that's really practically going to work. So that's my one point. My second point is I've also seen a hell of a lot of Delphi studies lately, and they all assume that, you know, someone somewhere, in actually a fairly small group of people that get asked again and again, have the answers for this. If they do have the answers, the question is, why hasn't it happened yet? And are those not the more important questions to ask? Sorry, if that's a bit tough. I think it's a really important field, but I'm not sure that your proposal has everything in it that will ensure that the answers you reach are going to be practicable. Thank you.
Okay, no, thank you so much, Kate. Maybe one of the things that I should have highlighted in my presentation was the whole approach. For me, I am not looking closely at healthcare professionals or whoever that is a professional, but more so getting information from disabled people themselves and their organizations. Because you find that whilst they have the answers, in terms of those answers and solutions being implemented, it then lies on the officials within the government. So having worked in government myself and understanding some of the processes in there, I then took an approach of having more disabled people involved in the study and contributing more towards what would then be solutions. And in that, I have already approached and introduced a study to the Department of Health, and have gone beyond that into the Office of the Premier, looking at the person responsible for the office on the status of the rights of persons with disabilities, to already get the buy-in even before the study is concluded, with the hope that whatever we find, and possibly if one can also, after the study, get some funding to do a postdoc, then the results of the findings would then be shared. The results of the finding will then be piloted somewhere within the province, and hope that would then give us a buy-in as a postdoc, where we're looking at now piloting and trying to implement what we found in the study. That is the approach in the direction that I'm heading towards.
Okay, thank you for the overview. We close this presentation with this explanation. Thank you, Sithembiso.